from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about what's urgent versus emergent when it comes to healthcare. Our guest today is Dr. Tara Wendt, an emergency medicine physician and the medical director of Sarasota Memorial's newest freestanding ER at Lakewood Ranch. Dr. Wendt, thank you so much for joining us.
Allison, thank you for having me today.
From your perspective as an ER physician, what's the fundamental difference between urgent care versus an emergency room?
Well, as an ER doc, I've been doing this for 18 years, board certified, and the fundamental difference between urgent cares and emergency rooms is going to be acuity. ERs are equipped to handle emergent medical conditions, rapid identification and stabilization of medical problems. They have more resources than urgent cares would have, so they'll have advanced imaging, advanced labs, and then obviously ability to escalate to a higher level of care if need be. Whereas urgent cares are generally better suited for many minor medical problems that we'll talk about later, but the acuity is lesser than you would see in an emergency room generally. Just know emergency rooms can handle the lower and the higher acuity as well.
Why do you think there's still so much confusion about which one to go to? Is it the failure in communication, infrastructure, or something else?
Well, I think part of it is the blurring of the lines is because a lot of urgent cares, especially Sarasota Memorial urgent cares, they have availability to do imaging. They can do small minor procedures such as suturing, simple abscess drainage. They have limited labs available, point of care testing. They're able to administer medication, whereas the emergency rooms cater to that higher level of care, but I think it could be confusing to the public when that higher level of care is needed. I think that a lot of times if you use like WebMD or Google certain things, you may be pointed in one direction versus another, but overall, obviously if it's a very critical situation or you're concerned that an urgent care wouldn't be able to accommodate your needs and you feel something just isn't right, I would advise to go to the ER.
What are some of the classic don't wait, straight to the ER symptoms that you think everyone should be aware of?
So first and foremost, if you're a person who has major medical problems, what we would call comorbidities, meaning you have, say, high blood pressure, cardiac problems, lung problems, diabetes, things like that, and you're having a medical issue, or it seems similar to something emergent you've had in the past, I think it would be important to know that an ER would probably be better suited for your needs, because in an urgent care situation, it may be hard to kind of get through those weeds to see what is really going on. If you're having chest pain that is new, exertional in component, meaning it gets worse as you're moving along, it's associated with shortness of breath, you're having high fevers, you're sweating profusely, those are things that are better suited to be seen at an emergency room. An urgent care would take you, likely do an immediate EKG to make sure that you're not going to be directed to a nearest catheterization center, and then go on and send you to the emergency room. So chest pain is an important one. Difficulty breathing. If you're having difficulty breathing, you're having difficulty getting words out, maybe it's associated with a high heart rate, or you take your oxygen saturation on the home center sensors, a lot of us got, during COVID, and it's low, or you have underlying lung problems, asthma, COPD, then I would say go to the emergency room versus going to an urgent care. And then abdominal pain, red flag symptoms to look for in abdominal pain. If it's severe abdominal pain, if it's associated with a high fever, if it's associated with distension, you're unable to pass gas, you're vomiting profusely, those are things that would better be suited at an emergency room because they're probably going to want some advanced imaging like a CAT scan.
So chest pain and abdominal pain that you mentioned seem a little bit like gray areas, I think. So how do you advise people to think about the symptoms and what is truly emergent versus not?
Right. So again, remember, if you have previous lung problems, immune compromised state, or other comorbidities, and you're having chest pain that you can't explain, I would advise you to go to an emergency room. If it's something simple, you took on a new workout routine, you did a bicep curl, you hurt your pectoris muscle, it's reproducible, you can push it, that's probably better suited for urgent care. Abdominal pain, again, if it's severe, if it's associated with distension, vomiting, can't keep anything down, you've had bowel obstructions or multiple surgeries in the past, better suited for an emergency room. If it's something like simple abdominal cramping with associated nausea, vomiting, diarrhea, even with low fevers, so it seems like a simple gastroenteritis, I think for something like that, a good place to start would be in urgent care. They could always medicate you, and if worst case scenario, escalate you to a higher level of care and direct you to an ED if the physician there feels that you need imaging or a high level of care.
In terms of wait times, people sometimes avoid the ER because they expect to sit for hours. Is that always the case?
No, not at all. So remember, well, it's important to remember the way an emergency room works. So emergency rooms triage based on acuity. You don't want to be the first, you want to be the person brought right back into the emergency room because we're anticipating that either you are going to escalate very quickly and need resuscitation, or we feel that this is something life-threatening and cannot wait. So we see the sickest patients first. Whereas urgent care, they're usually seen in the order that they come. Urgent cares can get quite busy, especially during cold and flu season. So those wait times may be delayed. Same thing with an emergency room during, heightened seasons where there's illnesses and you have, say, people with these comorbidities coming in, the wait times in the emergency rooms can be extended too. It all really depends on the time of day. So emergency rooms could be busier at nights when urgent cares are not open, or just slower at nights because it's a Tuesday night, everybody's, sleeping for work the next day. So you definitely see variabilities in wait times. The case in point, the new emergency room at Lakewood Ranch, Sarasota Memorials, we have relatively good wait times. We direct people back in a very timely manner, and people so far have been relatively surprised at how quickly that they're seen. Now, as season progresses, that can always subject to change as the population increases in a seasonal manner, but an urgent care versus an ER doesn't always equate to differences in wait times per se.
That being said, it's important also not to overcrowd ERs, especially during those heightened seasons. We don't want to cause long wait times for more emergent cases. So what are some good examples of conditions or symptoms that urgent care is more than well equipped to handle, and people should go to the urgent care closest or most convenient to them?
Sure. So things like the common cold, upper respiratory infections, simple gastroenteritis, like I said before, some abdominal cramping, vomiting, diarrhea, even with low-grade fevers, that's reasonable if you're able to keep fluids down and not feeling overly dehydrated. Simple lacerations, simple abscess drainage, broken bones that don't appear limb-threatening, or broken bones or sprains that don't appear limb-threatening. And when I say limb-threatening, I mean like if the bone is sticking out of the skin associated with profuse bleeding, or there's an obvious deformity of the bone, that's probably best suited in an emergency room versus an urgent care. Urgent cares are great for medication refills. We see a lot of that. Blood pressure checks we see at urgent care that doesn't have any associated red flag symptoms. Again, simple abdominal pain.
You're saying if you can see the bone,
Yeah.
heavy bleeding, all right, ER.
Right.
But you fall, sprain / maybe break your wrist, but you're not seeing any bone or anything, that's something that they can do the x-ray at an SMH urgent care.
And if it was something that required, say, setting or reset, urgent cares will splint and cast. That's reasonable. But if it's something that requires a procedure to put the bone back in place, yes, you will be directed to an emergency room. The other thing with lacerations that I see commonly coming from the urgent cares, if it's a complex laceration, meaning it's very deep, it's associated with profuse bleeding, patient may or may not be on blood thinners, or it's very complicated facial lacerations, or just like severe dog bites. Those are things that are going to take an enormous amount of time and resources to repair. Again, those are better starting off in an emergency room, in my opinion.
And one thing we haven't mentioned that I think we should clarify, head injuries.
Yes, 100%.
Straight to the ER.
Well, especially if you're on blood thinners, and we see so much of this directed to us. It will be a patient who trips, falls. It's generally over the parking blocks in the the supermarket, and they trip and fall and they hit their head and they're on blood thinners and they go to the urgent care to get checked out. And the urgent care, there's no stopping it. Go. We send you directly to the emergency room for CAT scan. And the reason being that we're worried about an associated brain bleed. If that is the case, you need emergent care. Time is brain in a case like that, and that patient could decompensate rapidly.
That's important to know. So if someone's at home debating where to go, are there any tools or apps that you recommend to help make the decision? Because as you kind of mentioned before, sometimes if you Google your symptoms,
Yes.
you find out that you have 7 different diseases that are all going to kill you.
Yes, right.
Not to make
right.
light of it, but the internet doesn't always tell you the true story. So what do you recommend as people try to figure out which to go to?
So there's a couple things you can do. One of the things, and I know that this could vary among insurance companies, but many insurance companies offer nurse lines. And now I'm saying this that you have time to make this decision, meaning that you're not actively, catastrophically dying at this point. Then you call 911. But if it's something that you're debating on, is this appropriate for urgent care versus emergency room? Many insurance companies have nurse lines that you can call that will offer you plus minus a quick telehealth visit or a phone chat, and will direct you accordingly. The other thing that I see quite often is patients will call the urgent cares or the emergency rooms and say, hey, this is what I got. Do you think that I could be seen at an urgent care? And if it's something quite serious, we'll say just come to the emergency room, because we already know, as professionals doing this a long time, kind of where this case is going to go. And it would be prudent to avoid that double visit where you go from urgent care then to an emergency room, because obviously it's uncomfortable for the patient. It's costly because there's an associated cost with urgent care versus the emergency room, and there could be a delay in care just by virtue to going from the urgent care then having to be seen at an emergency room.
That's a good point. Are there any situations where someone should start at an urgent care but be prepared to potentially go to the ER if needed?
Sure. I mean, if it's something that you feel that you can otherwise stand in line and wait, so you don't your spidey sense isn't telling you that this is critical, you can always start at an urgent care. But you have to be prepared if we see aberrations in your vital signs. So your blood pressure is low, your oxygen saturation is low, your heart rate is high. We anticipate a problem that may require surgery or admission. We will from there direct you to an emergency room.
That makes sense. Sarasota Memorial has 4 ERs, 1 at each of the hospital campuses in Sarasota and Venice, and then 2 freestanding, 1 in Northport and then the newest one where you work in Lakewood Ranch. Is there ever confusion that you see between patients if it's better to go to hospital campuses versus a freestanding ER?
Right. So freestanding ERs fill an amazing niche in the community because it gives you closer geographic access to your hospital system and closer geographic access really just to everybody. So if you wanted to stay within your hospital system, we have ERs in South County. Now we have a freestanding ER in North County where you could still be integrated in that system. With that said, if you do require admission, you would be then transferred for admission to a hospital-based campus. But especially Sarasota Memorial freestanding emergency rooms, we are fully equipped with all resuscitation efforts for stabilization. We have board-certified emergency medicine physicians 24 hours a day, 7 days a week. We have respiratory therapists 24 hours a day, 7 days a week, skilled nursing, advanced labs, advanced imaging, obviously including CAT scan and X-rays. We're able to do procedures there, small procedures that we would be able to discharge you afterward, and basically just stabilize you and then give you to a higher level of care once stabilization is achieved if need be, and that would include admission. So it may save someone's life because they're able to be seen quicker, stabilized, and then transferred to a higher level of care.
How do you recommend people decide I should go to the ER closest to me versus I'm just going to keep driving and drive to the nearest full hospital campus?
Well, I mean, if you're that critically ill or feeling that unwell, I would never recommend you going by car. I would recommend you calling 911, and they will likely take you to the closest emergency room.
Mm-hmm.
Sometimes people are able to ask specifically for the emergency room that they want. However, that's not always the case, depending on what county you're in, or what is the closest emergency room, or what they deem is the safest for you if they want to get you somewhere quicker. And then again, when in doubt, you can call your nurse line through your health insurance, which a lot of people have access to. And in addition, you could really just call the emergency room, and they'll kind of give you information as to, no, we think this is something more critical, and we feel that you should be seen in a hospital-based system if you're stable enough, because you will likely need admission or surgery or specialty consultation.
That makes sense. What's one thing you wish every patient knew before they walk into an ER?
Well, I think that expectations with wait times, again, understanding the triage process. Sometimes if you're there for something relatively minor, we're still going to give you a great level of care, but we may have to divert our resources temporarily to helping somebody that's sicker than you. The other thing is, and I tell this to all of my patients, put together on your person, carry a list of your medications, pertinent medical conditions, medications including your dosages, times that you take them, pertinent medical conditions and or surgeries, allergies. If you have a very specific advanced directive, these are very important things to keep on your person, especially if you're unable to communicate or you're not, say, in a position where you can communicate. It helps us piece together what's going on sooner than if we had to wait, say, for family to chime in. Or, I mean, there are resources that we can check. We can call pharmacies and things like that. But in the effort to save time, having that on your person is such a good communicator for the entire health team. And in the long run, it's going to benefit you because you'll get that care quicker.
One thing we didn't address in the urgent care versus ER discussion is, you might know how you're feeling. How can a parent with a child decide what to take their child for, urgent care versus ER? Because children often have fevers associated with every illness. So how can a parent decide?
So you really, I mean, your child, if your child behaviorally is not acting right. So I hate the word lethargy, but it's there. A child that just looks limp, lifeless, not very responsive. Those are things that I would be concerned that there's something bigger going on, especially if that kid's not perking up after maybe they have a fever, you get the fever down and they're still not acting quite right. That's time to go to an emergency room to be checked. Also, dehydration. If your child is vomiting, you can't keep anything down, you can't keep up with the diarrhea. Now you're getting reduced wet diapers, which is a big sign of dehydration. When the baby cries, tears aren't being made. Again, another sign of dehydration. You're going to be directed to an emergency room because at the very least, the child may need rehydration.
Absolutely. What's your biggest piece of advice for people trying to stay informed and make the right healthcare decisions under stressful times? Whether you're going to an urgent care or an ER, you're going to seek care for something that's concerning.
Have a plan. So know where you live, know your nearest emergency room, whether it be freestanding or hospital-based, know your nearest urgent care. Obviously have access to being able to call 911. Have your list of medications ready to go if need be. Just a little bit of pre-planning in a time of stress where you may not be thinking very clearly. That kind of pre-planning can certainly help you make better decisions and get you faster care.
Is there anything else you want to add?
Again, have your medication and medical problem list readily available. Know your plan as to where you would go or where you would go depending on if you needed something urgently, emergently, like an emergency room, or something simple like your closest urgent care. Make sure that your family is aware of where you would likely go if you had an emergency. If they're unable to locate you, that would probably help them out to figure out where you are ultimately. And when in doubt, if there's any question and you don't feel right, don't stop at urgent care. Go to the emergency room.
Definitely makes sense. Well, Dr. Wendt, thank you so much for joining us.
Thank you very much. Thank you for having me.
If you liked this episode of HealthCasts, please like and comment and visit smh.com/podcast to listen to more experts like Dr. Wendt talking about health issues which matter to you and your family. As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.